Imagine that on your first day of a new job, you take the reins of leadership in the midst of the biggest health emergency of the last few decades, and that at the moment you take a seat behind a new desk, you're responsible for the health of over 275,000 people. My guest today doesn't really have to imagine it because she lived it when she became the health director for the Roanoke City and Alleghany health districts in the midst of the COVID-19 pandemic. Dr. Cynthia Morrow is that person, and she joins me today. Welcome, Cynthia.
Thanks so much for having me.
I'm just so glad to, we've met a couple times, but you have been very, very busy in those times, and I wanted to get a chance to know you and to get your thoughts on public health in the region in general. But before we talk about that, we talked a little bit before this about your path to your current position, and I think we could talk for half an hour about that if we wanted to, but tell me kind of what prepared you to be the Director of Public Health here.
Well, I was really lucky. I grew up in a public health family, so my father worked with the World Health Organization. I lived in Uganda, Ghana, Switzerland, and so public health was in my blood. When I went to medical school, I did my MPH at the same time because I really wanted to understand public health. I did do clinical medicine for a few years, but my heart has always been in public health. So I was a local health director up in New York, and when our family relocated to Virginia, my husband's family is from Roanoke, long family history here in the Roanoke Valley on my husband's side. I was very curious about the local public health system, and it was really hard for me to be on the sidelines when the COVID-19 pandemic started. And so when I found out that the health director position was open, I had to apply because that's where my heart was.
Well, I'm glad that you did. You did arrive at a tough time. I mean, in addition to having to figure out where the paper clips are at the office, right? You had to get to know the key players. What were some of the first things you did in those first months when you were taking the reins?
Well, even before I officially took the reins, Dr. Molly Odell, Dr. Laura Cornegay, they were really just the heart and soul of the initial pandemic response. And they had a huge team of people working with them, a whole, Dr. Kirkran, there were just a whole bunch of people. And so in the beginning, I really worked with them. They were by my side every step of the way before I even started, helping me understand what the community was about. And I was also fortunate because I knew a lot of people in the leadership at Carilion, and so I had learned about the healthcare delivery system. I do teach at the medical school, so I knew a lot of people from the medical education side as well. So trying to get all of that information, even before I started working with key stakeholders, was really instrumental, and I couldn't have done it without that team.
As I often do, I learn about the subject a day before I have to interview someone, and I have been here a long time, but seeing how the different communities are connected through the State Department of Health, tell me a little bit about just your territory. What are you and your office responsible for? Yeah,
so that was also a big learning curve because where I was a local health department before, it was one jurisdiction, a local health director before, it was one jurisdiction. And here, we have 7 jurisdictions. And so trying to learn who the different elected leaders are in the different jurisdictions. So we serve Alleghany County, Botetourt County, Craig County, Covington City, Salem City, Roanoke City, and Roanoke County. And so there are diverse needs of these different jurisdictions, and one of the other things I did once I became director was I went out to every jurisdiction and I met with people. We have an amazing team at the health department, just wonderful, wonderful staff who are really dedicated to the communities that they serve. So getting to know our staff and getting to know some of the key players in each of the jurisdictions was really important.
And then you also are a part of Region 3, right, yes, which is the western, very similar to our viewing area, actually. How do you work with those other directors in the other localities west of here and a little bit east as well?
So one of the things that has been a really good thing about the COVID-19 pandemic is that our interagency communication has really been enhanced. So every week We have a couple of meetings at the state level where we all get to talk, make sure we're all getting the same information, and that's really through leadership at the central office level. But in addition, we have regional meetings just with the regional health directors. So I talk with my colleagues in New River Valley and in Pitt Dan and Central Shenandoah, where at different times we just will share information, share resources, and really public health is the responsibility of everybody. And so our big thing is reaching out to people and gathering as much information as we can.
I say to many people who sit in your chair, like, I don't want to say that there was anything good that came out of COVID, right? And we're still in the midst of a public health emergency. People are still dying. But most folks, whether they run a nonprofit or whatever they do, can point to specific things that COVID actually helped in terms of their processes or programs. Are there things you think that, you know, this pandemic has caused you all to do things better that might serve us better in the future?
Yeah, I think, and I agree that it's really hard to look at a pandemic that has hurt so many. It's touched every single family. When we've lost over 1 million lives, I mean, that's a huge loss to our society. And I think it is our societal obligation to find good. There has to be something that comes out of this pain that we've all suffered. And I think for us in public health, it provided such an opportunity for us to build bridges. And so our relationship with Bradley Free Clinic, with New Horizons, with Virginia Harm Reduction, with all of these organizations, with all of our healthcare facilities, with our schools. Every week I was on the call with the superintendents, and we were able to build these connections that I think are really going to benefit us as we move forward, whether we're looking at the opioid crisis or whether we're looking at school nutrition or the youth behavioral risk factors survey. There's so many opportunities for us to work together. And I think it would be a huge disservice to those that we lost if we didn't try to improve what we do after the pandemic.
And I want to talk about more than just the pandemic, but I think it has so much relevance. Sure. And feel free to tell me this isn't your area of expertise or whatever, but you know, it occurs to me that departments of health have not traditionally been a super political thing where you know, people doubted what you did or doubted the efficacy of your expertise. How hard was it, given that there were people out there spreading disinformation about what was going to help us bring an end to this pandemic, when you knew that what you were, you know, you knew the safety of vaccines, for example, you knew those things?
It has been, and it will continue to be the biggest threat to the public's health, I think, is misinformation and disinformation and the viral spread of disinformation. But I also think it's our responsibility to look at why are people believing something that we know not to be true, and how can we forge relationships with individuals who may think differently from us and build trusting relationships so that in a crisis they can trust us and the information that we provide. And I think that that's something that at the global level, at the national level, at the state level, maybe you don't trust the person who's speaking, but at the local level, that's the beauty of being local. We can create those relationships. We can reach out to individuals and try to understand where they're coming from. Where is the fear that has created this opportunity for disinformation or misinformation? And I'm really hopeful that over time, there's a lot of healing that needs to happen. I'm really hopeful that over time, with outreach, with our team members who are embedded in our community now, public health folks who really, our goal, our desire is to understand where people are and meet them where they are so that we can together find a truth that fits all of us. And I understand, I don't agree with people who don't believe in vaccines, but I understand that there's history there, and I need to make sure that we recognize them, that we don't, you know, that we don't dismiss them, but we say, help me understand where you're coming from, help me understand where your concerns are. I think that's the only way to move forward, is with mutual respect and building of trust.
Sure. That said, how are we doing in this area in terms of immunizations for COVID? And then we can talk about some of the other things we should be making sure we're paying attention to as well.
Well, you know, I think at this point we have to be really realistic that one, we know that COVID vaccines have saved hundreds of thousands of lives. There's that, the science is there, well, the math is there, right? We know that that's true. But we also need to remain humble that this virus is a sneaky bugger that changes all the time. And so the most recent variant, BQ1, you know, there's so many variants.
That's the one I had.
Oh, geez. The BQ1 is smarter, and you know, we don't want to personify viruses, but this particular strain seems to be outsmarting our immune responses better than some of the other strains. And so I think we need to be humble that this is not, the vaccine is not a perfect tool. It's the best tool that we have, but it's not a perfect tool. And we have to own that, and we have to accept that, and we have to say, no, it's imperfect. And it's the best thing that we have available to us at this time. One of the things that we're seeing, of course, is every time there's a new vaccine available, so the bivalent vaccine, which has Omicron, covers for Omicron as well as the original strain of COVID, we see an initial surge in interest, and then that wanes pretty quickly. Our bivalent booster for children was just approved. We're going to see a little surge in interest, and then it's going to wane, and that's okay. I think our big thing is anyone who wants to increase their ability to protect themselves, we've got vaccine, we can vaccinate you. Our pharmacies have vaccine, some doctors have vaccine. If you want to minimize your risk, that's the best tool that we have.
Right. But it's not just COVID, right? There's lots of other things that you're responsible for and that we need to be aware of. As we record this in October of 2022, I'm hearing a lot about being careful about the flu, right?
Right.
I mean, thankfully, some of the things we've learned in COVID about washing our hands and,
staying home when you're sick, that's a big one.
So, but tell me about flu immunizations and where that stands and how people access that.
Yeah, so flu vaccines, of course, I'm going to be the strongest proponent. Go get your flu shot. Flu activity is definitely picking up in Virginia. We know across the country, we're starting to see increases in Virginia. We're starting to see increases. It's a little early, but you know, typically we see our peak activity in January, February. But right now, we think it may be an early year for flu, so please get your flu shot. The health department, each of our localities has flu vaccines available. Older people, we recommend the high-dose flu vaccine, certainly pharmacies and primary care provider offices. There's so many places now for people to get their flu vaccines, and we certainly support it. In the meantime, we also want to make sure we have a really stoic culture in the United States. I can go to work even if I'm sick. And my big ask of everybody is you may be fine, but think about everybody else. So don't go to work if you're sick. If you have a fever and a cough, stay home.
Right. And just because it's not COVID doesn't mean it's not still important.
Right.
One of the folks I work with asked me to ask you about monkeypox. Do we have any? Is there monkeypox here? What do we need to know or to fear or to be prepared for?
Well, so monkeypox, we did have some cases. We haven't had any new cases in quite some time. In our region, we've had a total of 9 reported cases of monkeypox in our districts. And I think that the big thing about monkeypox is this, we really are at the tail end. It was a beautiful, normal distribution, which I know that sounds kind of geeky, but it really is a classic outbreak distribution. So I think that we have, for the most part, controlled it through information, vaccinations, and behavior change. And we really want to make sure that whether or not it's monkeypox, we're seeing a lot more syphilis this year than we've seen in the past. We've seen increases in gonorrhea and chlamydia. STIs, monkeypox is not an STI,
Right.
but it's acting like an STI. So it can be transmitted. If I had it and you and I rubbed arms, you could get it from me. It's transmitted by close skin-to-skin contact. But the bottom line is we really want to encourage safe sexual practices because even if monkeypox isn't a huge threat in our community today, other diseases are, and so we really want people to practice safe sex.
I know, and sometimes I think we forget, like those of us who are maybe not in our teen years anymore, not in college, like STIs are still a major health issue, right?
Oh, they are, and they are increasing, and that's one of the things we want to make sure is that information is out there. And we're not teens, but I'm telling you that there are people in their 40s, 50s, and 60s who are getting STIs. So no matter what age you are, you should engage in safe sex practices.
And you guys do have, and we talked about that, so you have a very broad portfolio. I mean, everything from what we've already talked about. Tell me a little bit about the Newcomer Health Program.
So, the Newcomer Health Program has a really soft spot in my heart because this is where we welcome refugees from many countries. Afghanistan is the most common country that we are welcoming people from now. And we make sure that they have their immunizations, that they have their tuberculosis tests, and we make sure that we're protecting their health as well as the health of our community.
And I sometimes forget that tuberculosis is still something we have to be worried about, right? What do we need to know about TB?
Well, in general, it's really a low risk for people who are not at increased risk. So if you're born in another country that has a lot of TB, that's going to be our number one risk. People who are incarcerated might be at increased risk, but really we're looking at where people come from, where there is a lot of active TB. That's our greatest risk. And it's completely treatable as long as we know about it. So we have a great program where we not only treat people who have active disease, but if you've been exposed and you have latent TB, we can also help you with that as well.
One of the things that I know you all are involved with, and you're partnering with our other organizations, one of the biggest health problems here before COVID and during it, opioid substance use disorder. What is the role of the health department in helping to fight that?
So in general, the role of the health department is to be the chief health strategist in any community. And so what we really try to do is see where there are gaps. So we do assessment, policy development, assurance. Those are our three functions. But to work with our community partners and try to fill in the gaps. We provide Revive training, but right now we've been really working closely with our harm reduction partners, our drop-in centers partners, to look at hepatitis C, which is very common among people who use injection drugs. Unfortunately, we all know we've had a huge hepatitis A outbreak. So trying to bring people into care, and just as an example, by working with Virginia Harm Reduction and the drop-in centers, we've actually been able to help some people get family planning services, which we offer, STI treatment, which we offer. If there's a family that has a child who needs WIC services, we can get them enrolled in WIC services. So we try to ensure that anybody who needs comprehensive services can get those services through the health department.
And not everybody knows what harm reduction or Virginia Harm Reduction Coalition is or does. We've actually had them as a guest on this show, so I'd encourage anybody who's got questions about that to go to our Echo channel and look that up. But can you kind of give us the thumbnail of what does the Virginia Harm Reduction Coalition do that might be easier for them to do than it is for you all?
Sure. So one of the things that we really need to recognize is that people who have substance use disorder, people who use injection drugs, getting them into drug recovery may not be possible at that moment for that individual. We need to meet individuals where they are. And so what we want to do is reduce their harm of other things, reduce the harm of a fatal overdose, reduce the harm of an infection. And so that's the harm reduction. We try to make sure that anybody who wants to get treatment has access to treatment. And in the meantime, let's try to reduce the risk of infections through syringe exchanges. Let's make sure that people have Narcan available so that if they do overdose, they can survive that overdose and hopefully get the care that they need. Ultimately, our goal is to have a drug-free community, right, where people do not have substance use disorder. But we have to be realistic that there's so many people in our community who do have substance use disorder, and they need as many services as those of us who don't.
Right, and should be treated as patients worthy of care.
Absolutely, with dignity and respect.
And we have an 87% treatment gap where only a small number of people who need treatment can get access to it, and it isn't necessarily the best thing for everyone to be able to go away, or it might not be possible for them to go away to a treatment. So harm reduction is an important part of the public health portfolio.
Absolutely.
But you also do things like make sure that people know how to use their car seats, right?
We do. We have a car seat education program. We don't want any family to not have the opportunity to protect their child because they can't afford a car seat. So we can provide car seat and, most importantly, the car seat education that goes with that. But we also inspect restaurants and septic systems and your wells. There's all sorts of things that we do to make sure that our community is safe.
I want to step back just for one more question about opioids, and it's a question that comes up a lot. Is like, what should parents know about the current opioid crisis and how to talk to their kids about it?
I'm not sure I'm the best person to answer that, except that it is really common and no family is immune, and it is not a failure of parents if someone develops substance use disorder. It is so prevalent, and there are so many societal reasons that it's so prevalent. Some of it is based in the healthcare delivery system and the fifth vital sign of pain. Like, there's a whole, which I know you know, the whole history behind it. But I think that for me, the most important thing is that stigmatization of substance use disorder only causes more harm. And, you know, I am very open that I had a child who was flirting, was right on the edge, and it was really challenging to keep him safe when he was flirting with things that we didn't want him to be flirting with, from a safety perspective. And I've always said, you know, I told him at the time, I'm never going to be embarrassed because you started using marijuana and alcohol when you were a teenager. I'm going to talk about that because we need to talk about it. I am never going to be embarrassed that you struggle with this because so many families are struggling with it. We cannot stigmatize substance use disorder.
One thing that I don't know what your role is on this, but I know, you know, smoking and vaping are still a huge issue especially for kids who have developing brains. Sort of how do we, again, you're not a parental expert, but how do we talk about that with our kids, and what should we know about the dangers of especially vaping?
Well, you know, I'm sure you can guess where I stand on all of this. Well, I think that first and foremost, we need to empower our parents to talk with their children. We know things like, when possible, eating together as a family can be protective. Talking about it is protective. Not talking about it can actually be a risk. So, you know, I'm definitely not the expert on this. I'm not a parent expert and I'm not a prevention expert. But these are things that we know from a public health perspective. With respect to vaping, we know that it can cause lung disease, and we have seen it, and it is not safe. People say, well, it's safer than tobacco. It depends on what you're looking at. When my son used to say to me, well, wouldn't you rather that I smoke than I drink or something like that? I'm like, no, I would rather you do neither, right? I would really rather that you protect your own health. And I think that that's really I think that that's really important, that we empower parents and children to get good information. It gets back to the misinformation and disinformation. Vaping is not safe. It's not. Tobacco is not safe. We have decades of evidence. Keep yourself as healthy as you can. You only have one body.
We're down to just a couple minutes. I know that you also, help promote emergency preparedness as a health department. What should we all be ready for?
So we have great emergency planners working with us. We don't know what the next emergency is going to be, whether it's a pandemic where we're going to have a shutdown and we need to know that we need to have a food supply or medicines. So there is a whole preparedness task list that we have for families, and we can certainly share that information with you.
And we'll make sure that's available.
Yes, absolutely. And we're prepared for the community. So there's community level preparedness, and then there's individual responsibility preparedness, and we certainly try to support both.
Well, we could talk for a lot longer because I've got a lot more questions that we could have gotten to, but that's all the time we have. And Dr. Morrow, I really can't thank you enough for taking the time to join us today. If viewers want to learn more about either the Roanoke and Alleghany Health District or any of the other regional offices in our viewing area, I encourage you to visit vdh.virginia.gov, where you'll find the links you need to direct you to the proper office. For What It Takes, I'm Tom Landon.